When I talk about pushing versus pulling when we walk, we're essentially talking about whether we're using the muscles in our back, in the back of the butt, which is the gluteus maximus muscle, versus the muscles in the front or the hip flexors. So when we push, we're using the muscles in the back to push off the ground and push the body forward. And you can see when I do that, what happens. We essentially have sort of a lunging sort of action versus what we do when we walk properly is use the muscles in the front to pull the body forward. There's a lot of people out there that say we are pushing and using the glutes, and they ask you to feel your glutes when you walk, make sure that your glutes are activated or firing when you walk. But what does that really mean? If I'm going to fire my glutes, that means I'm extending my hip and back of the body to walk. And that's the result of that sort of action. So what I am asking you to understand is that during that swing portion of gait, where the rear leg leaves the ground, we're not pushing off of anything. I'm not pushing with my back hip, and I'm not pushing with my front hip. What I'm doing is using the muscles in the front of the hip to pull the body forward, like a lever. If you can see the angle between my upper leg and my knee and my torso, you can see that it is angled backward. And what we're going to use is the muscles in front of the hip to tilt the pelvis forward at the hip joint in this sort of manner. We're using our lower abdominal muscles to tuck the pelvis at the same time, and that's what results in the smooth gliding action of a normal controlled walk. Let's start the demonstration from the position where we are forward on the standing leg and the rear leg toes are touching the ground just before we initiate the swing through portion of the gait. This is where people often think they have to push off to get the body to move forward. And let me demonstrate why that thinking is incorrect and why we're not pushing off, we are pulling. From this position, my center of gravity is behind my standing leg or my standing foot. If I were to push or extend using my glutes on the left, that's what's going to happen. I'm going to push myself back. I also can't push off with the back leg because the back leg has gotten me to this point. At this point, the back leg needs to leave the ground, moving forward. It can't simultaneously be pushing back and moving forward at the same time. So what's really happening? What we're doing at this point is using the hip flexors to pull the body forward like this, while at the same time using the lower abs to tuck the pelvis under and help the body glide forward. The lower abs are not only tucking the pelvis, but they're also going to be rotating the pelvis. When I'm using my lower abs on the left, they're going to be tucking the pelvis on the left and rotating the pelvis around to the left side, contributing to the forward swing of the body, while I use my upper abdominal muscles to keep the body facing forward. That's the gliding action of a pull. When we push, or when people think they need to push, this is what happens. From this position, if I extend my left hip to push, what's going to happen, as I already mentioned, is I'm going to push myself back. If I extend the back hip, what's going to happen is I'm just going to push myself up like this. So what people do in order to move forward with a push is they actually lean the body forward. Now I can push and I get that sort of action. I end up pitching forward and crashing into the heel, which we all know is a bad thing. A lot of people believe that we should not be landing on the heel because people get heel pain and leg pain because of heel landing. That's because of people walking like this. That's not because of people walking normally like this. There's no impact when you walk normally by pulling the body forward.